everyone. Welcome to our Sports Medicine Association Singapore Sports Medicine series for this quarter. Today, we are very happy to share with you our theme on team sports in the time of COVID-19. We do have two very esteemed speakers with us, Dr. Teoh Chin Sim and Ms. Nurhafizah, who will be talking to us about their experiences with managing sports teams in this pandemic. Right. A few ground rules first before we begin. Before that, just a bit more about us from SMAS. So SMAS, Sports Medicine Association Singapore, who we are actually a registered society for sports medicine and sports science professionals in Singapore. This is our webpage here, www.sportsmedicine.org.sg. Do visit us. If you are keen to join us, please, there's a page over at the website that you can check for more information. For any inquiries, you can email us at smas.secretariat@gmail.com. We are also active on Facebook and Instagram with our handles below over here. Our members include that of sports doctors, general practitioners, orthopedic surgeons, physiotherapists, podiatrists, nutritionists and dietitians, exercise physiologists, sports scientists, and sports psychologists. Right. Please note that we are actually recording this webinar on Zoom as well as live on Facebook, on our Facebook wall. By attending this event, you are hereby giving your consent for your image, for your voice to be captured, and for data to be used for our publicity purposes in the future. Please do not record the symposium on your own. Attendees will be muted upon entering the webinar, and please post any questions or comments in the chat function, and we will address them later on during the Q&A session. Okay. At this point in time, I just want to invite our president, Dr. Dinesh Sirisena, to say a few words before we begin. Dr. Dinesh, please.
Thank you, Joshua, and thank you to everyone for joining us. As weeks go, many of you will know that this was an incredibly sad one, where we saw the passing of one of our very esteemed colleagues, Dr. Teoh Chin Sim. And many of you will have met Dr. Teoh at some stage of your career, particularly as he was one of the early sports physicians here in Singapore. He was involved with the Sports Institute and as it transitioned through its various phases. And I think he was quite pivotal in training and teaching many of our leading figures in sports medicine today. We know that Dr. Teoh has experiences beyond what many of us could comprehend, and his knowledge and his humility was just simply humbling. And he grew sports not only here in Singapore through local initiatives, but he also helped our athletes and put Singapore on the map through his various attendances at conferences, events, and committees. I know we all have our individual stories, and it's not possible for everyone to share here, but if I can just tell you a little bit about how I knew Dr. Teoh. So when I first arrived in Singapore 6 years ago at KTP, I was somewhat naive of how things worked and how things were done. Although the medicine was the same, the cultural differences, the practices, and so on was very different. And I was privileged to have Dr. Teoh as my mentor and supervisor, and he guided me to my full registration. And he was always taking time to see if I was okay or if I needed any other support. And later on, once I achieved it, he was not just a colleague, but also somebody I could put my complete trust in and could counsel on a variety of matters. Dr. Teoh was a very patient man. He was kind, and even though his illness was taking its toll on his stamina, he was always there when we needed him most. And he was always putting other people's needs above his own. So yeah, it's a great loss. And over the last few months, we know that Dr. Teoh's condition deteriorated and he passed away on Wednesday. To me, he epitomized kind of what sports medicine kind of stands for. And it's where we work together as a team in a team spirit. We push the boundaries of human abilities and we take care of our patients with compassion and integrity. And I think he really kind of epitomized everything that we aim to achieve. And I just want to say, Dr. Teoh, I know you're not with us anymore, but I really miss you, and I'll miss your guidance and everything. So I'd be grateful if you can all join me for a minute to show our respects for Dr. Teoh, and yeah, we'll just hold a minute silence if that's okay. Thank you, everyone. Just as a final thought, the SMAS, we're going to be putting together a memorial page on our website for Dr. Teoh. The exact nature we haven't finalized, but if you're interested in contributing, please let us know. It's open to members, Exco, and let's once again show our respect for Dr. Teoh, who's a great physician, a great colleague, and just overall a wonderful individual. So thank you very much, and let's continue with our presentations.
Thank you, Dr. Dinesh. Before we invite our first speaker, just a quick reminder to give us your feedback at the end of the webinar. We will be providing a link in the chat box. Alternatively, you can use this QR code to access our feedback page, a feedback form. For those coaches under NROC, this webinar will allow you to record 2 continuing coaching education hours, but you will need to fill in your details in the feedback form. For Singapore registered physicians, doctors under the Singapore Medical Council, CME points have been applied and are pending. If you intend to claim them, you will require to fill up the feedback form and enter your details in the feedback form. We apologize that those who are not under SMC, Singapore Medical Council, will not be able to claim any points officially, but if you would like certificate of participation, it is on request. Please email us later on. Without further ado, it gives me great pleasure to invite Dr. Shauna to introduce our first speaker. Shauna, please.
Good afternoon, everyone, and thank you for joining us at today's SMAS Sports Series. To open this afternoon series, we have Dr. Teoh Chin Sim, Senior Consultant and Clinical Director of the Sports and Exercise Medicine Center at Khoo Puat Hospital, where she cares for both competitive and recreational athletes. Dr. Teoh has served as the Chief Medical Officer to Team Singapore at multiple major games, the most recent being the Tokyo Olympics. She also worked at the Rio, Pyeongchang, and Tokyo Paralympics as a member of the International Paralympic Committee anti-doping team. Come 2022, she will wear a new hat as a member of the Commonwealth Games Federation Anti-Doping and Medical Commission, overseeing the delivery of the anti-doping program and medical services in Birmingham. Today, Dr. Teoh will be speaking about her experience in preparing to take care of Team Singapore at the Tokyo Olympics. Until mid-2021, many had wondered if the already postponed Tokyo 2020 Games would be held at all, and it would prove to be the most challenging in terms of its health and safety precautions and planning due to the ongoing global COVID-19 pandemic. Dr. Teoh will share experience and how her medical team prepared and rendered care to ensure the health and safety of Team Singapore. So without further ado, let us welcome Dr. Teoh to deliver her talk.
Hello. Hi. Shauna, can you help share the screen? All right. Hi, everyone. My name is Chin Sim, and thank you for the introduction, and thank you to SMAS for inviting me to speak. Just for everyone's knowledge, Dr. Teoh is one of the founding members of the Sports Medicine Association itself, right? Just for our knowledge, right? And the logo that you see, the original form, I did a little bit of my handiwork, and then it has since been modified. Yeah, so that's the history of our Sports Medicine Association. And many of us attending here, some of us have been former presidents of the association, including Dr. Teoh himself. So thank you so much for letting me share. Right. Yeah. So this talk is entitled, preparing our team for Tokyo 2020 during the global pandemic. We didn't know in early 2020 whether it was happening at all or not, and even into 2021 until May, we were still wondering whether there was going to be any Tokyo Olympics and Paralympic Games. But anyway, it came to an end, and after that, the next thing was Paris 2024. The next thing is coming in. Everybody, just okay. If we can do Tokyo Paralympic Games and Olympic Games, we can do anything. Okay, so there was no question about whether they were going to be to Paris 2024. So can I have the next slide? So this is this will be kind of a picture plus some basically my experience, and as well as what we found there, what we prepared, and how we came back all safely. Okay, so this is a picture of the Olympic Games village, and behind there is what you see where we stayed there. I stayed there for 25 days. Okay, some of the athletes and officials stayed there just for lesser than that, because we were only allowed 2 days into the village before the competition, and 5 days before at maximum, and had to leave within 2 days of the competition, the ending of the competition. Right. So this is the Olympic rings at one part of the Tokyo village. Right. Can I have the next slide? Okay. So when we prepare for games, any games, and the Olympic Games and the Paralympic Games are the epitome and the dream of every athlete. And if you are an official, every official, it's like their dream goal. Yeah. And everything wraps around the athlete. So what you're seeing here now is the athlete is our VIP, right? They are the important person, and everything we do wraps around them. So you can see there's we look after their health, and that's one. The medical portions of it is a big portion, because this is a physical sport. So if their physical health is impaired, then what happens? Physical health, mental health, emotional health, social health, all that, if in any form is affected, they may not be able to put on their best performance. Right? We need to do training, equipping of personnel. We need to support them from the sports science perspective. By that, we mean psychology, biomechanics, nutrition, physiology. We need to look after, make sure the accommodation where they are going to be is comfortable. They can sleep well. They don't get backache from too hard a mattress, too hard a pillow. Right? We need to prepare surgical supplies, medical supplies. What we need to pack. And then we need to look into the matters of if they're on any medication that may be on a prohibited list, and that we need to apply for what we call therapeutic use exemption. There's what we call the area of safe sport, which has to do with harassment and abuse in the sporting setting. Logistics and operations, how do we transport our athletes there safely and transport them back? Everything from air tickets to any of their equipment that needs special immigration clearance, customs clearance. And then, of course, the big thing was COVID-19 preparation for these games, okay, which took up a lot. I mean, I think the number of hours I spent on meetings tripled to quadruple, yeah, compared to any other games that I have ever been to. And this is also the games where I had the smallest number of athletes I ever had to care for, but the time spent was the largest amount of time. Okay, can I have the next slide? Okay, so I think the idea here is prepare, right? Prepare and prepare. Just like now for the COVID-19 battle that we have in Singapore, we prepare and prepare. We will need so many ICU beds, but we already prepared another so many, 100 extra, another 100 beds if we need to, if we come to a place where we need to access more beds to take care of severely ill patients. So we're the same. When we went to prepare for Tokyo, we prepare as best as we can. So the area of health of not just athletes, but also officials, because officials make a big part of the contingent. We had 23 athletes for the Tokyo Olympic Games, but the total contingent was just over 60 people, because the rest were all officials and coaches and team managers and people like me, just the doctor, the physiotherapist. Okay, so what happens is part of the preparation is to ensure during what we call a health screening or sports screenings process that we pick up any pertinent medical problems of our athletes so that we can follow up properly and know exactly what their health status is before we go to Tokyo, right? And then constantly we need updates from their physiotherapists, from their sports scientists, all that is necessary. Sometimes may even be maybe the dietitian, okay? And then we also had athletes and officials not just based in Singapore but abroad. For example, the picture there you see is Sergio. Yeah, Sergio is the coach of Joseph Schooling. Yeah, personal coach of Joseph Schooling, and Cheng Wen also. Sorry, Cheng Wen was in another location. So, but he was overall in charge of the team, the swimmers that were in Tokyo, right? And Ting Wen also, right? And so we need to care for all of them, overseas as well as locally. So I was having to communicate with, for example, their physiotherapists or whoever was looking after them abroad, right? As needed. And then sometimes athletes may get injured during during preparation phase. So sometimes it could be a need to substitute them as well, right? So they have standby athletes, right? In this case, in this time, we didn't need to substitute anyone, okay? And then the area of doping, just like I mentioned just now, yeah, so we have to look into that matter. Quite a few of our athletes are they take some kind of some supplements, and what happens is we need to ensure that those supplements are supplements that are pure, that they are not contaminated by any substances that may be on the ban list. Okay, so this is part of the preparation. Can I have the next slide? Okay, and then we also select our team, right? Our medical team that goes with our athletes to to Tokyo. So you see down there in the picture now, those are our team, our medical team. And when we had this meeting, we are in different locations. Okay, this particular one, we took this picture when we were already there. So in the top left corner of the picture, you see one group of us. Those are the sports medicine and sports science staff who were in Tokyo main games village, right? And then in the center there, that's Jocelyn. Jocelyn was in the Sailing Hotel in another location. Pauline Leong was still in Sengkang Hospital in Singapore, right? And then Sik Hui was in another location. Okay, she and this on the left, that's Sik Hui. She was in another location with the badminton team. And then on the bottom right corner was our psychologist in the sailing center, sailing hotel as well. Okay, so we are all disseminated, right? And because of this, we need to select our personnel well so that they are familiar, because many a time they have to even operate independently, yeah, out there remotely. And then as a medical doctor, I may be doing what you call video consult or phone consult, all right? And I don't actually see them. So we have been doing this for quite a few years, actually since 2015 SEA Games. We have been doing this kind of remote consultation, all right, long before COVID came here to hit the shores, yeah? So we need to plan for what we call before departure, what we need to prepare during games time itself. Yeah, how are we going to operate and forecast, as well as after games, what do we do? Can we have the next slide, please? Okay, some of these slides I prepared, I've kind of there are a couple of slides that have been prepared by Dr. Wang Ming Chang, and he was the CMO of the Paralympic Games. I think he's tuned in as well. Okay, yeah. So what I'm sharing would be something that both himself would have also prepared similarly for Paralympic Games, except for a few exceptions. Okay. The other preparation we were mentioning was we need to prepare talk to the sports science team, because, for example, there may be some recovery snacks and fluids and drinks and things like that we need to prepare, especially for certain teams or certain of our athletes, right? We had our psychologists as well, 2 psychologists, as well as a biomechanist on site. Okay, some of the sports psychologists supporting our athletes were actually abroad. They were not in Singapore. That's just because of how they work. Okay, we also work closely with what we call the secretariat team, security, as well as logistics, right? So before the Olympic Games actually begins, even in 2019, there was already a recce team who went there. In 2020, went to recce the place. And so what you see in the picture there is actually the Games Village. Just now I was standing up here at the Olympic rings. This here is the park that is all these apartments face. Okay, and this is the part of the Tokyo Bay, right? And so recce teams go and recce the place, so that we all, either on the pictures they gave us, the slide deck they give us, manuals, or we physically go there, because at one time we were looking at having what we call a Singapore house. That means outside of the village. But in the end, because of COVID, it was very difficult to do this. So we located ourselves just in this place, as well as in the sailing hotel, okay, for the Olympic Games, right? And when we go to such sites, we need to find out what is available, and also contingency planning. So we work quite closely with our Singapore embassy there, okay, the Ministry of Foreign Affairs outpost down there, right? We also need to examine and think about the disasters, because, you know, in Tokyo, we potentially could have typhoons, tsunamis, earthquakes, right? And that can ever happen. And so we also needed to plan for this, okay? And in relation to this, we work closely with what we call a crisis ops team. It's a big, huge team. The meeting that I attended was comprising of 50 people, and they're online, there were even more, okay? More people attending this meeting. It's a multi-ministry meeting, just like what you see the task force meeting for COVID involves many, many ministries. So did our team, just to look after 60 people, right? There were many people looking after many things in case any disaster happened, right? We also connected with what we call the Medivac, which is in the event you need to evacuate or repatriate Singaporeans from Japan to come back here. And we clued in with what we call the Pearl Liaison Center at Tan Tock Seng, because there was also COVID still raging, and still is raging around the world. So in the event that any of our team members had COVID, and for whatever reason we need to evacuate, right, and bring them back to Singapore, we needed to set up a protocol and a workflow, yeah, including managing even, like, say, next of kin, the media, and many concerned Singaporeans, right? Okay, so before the game start, we actually go in much earlier before the athletes arrive, right? Next slide, please. Next slide. Okay, all right. So these kind of doping control guidebooks, custom and freight forwarding guide, these are all given to us, soft copy, hard copy, so that we can make reference to it. Because when we bring in equipment and medication, can I have the previous slide, please? Previous slide. Oops. Yeah, sorry. Okay, sorry. Beg your pardon. Sorry. Okay, so we use these guides to guide our what we bring in, and we check against the checklist to ensure that we comply, because we don't want our supplies and medication to be stuck at the airport, okay, and then cannot come through, right? Also, every country is unique. So the Japanese custom may have their own rules and regulations. So we need to be quite careful about it. So, for example, like things like vaccination, for example, because it's not just COVID vaccination, but other vaccinations that we have to, we may need our athletes to do before they leave, okay? And then all our medical personnel need to be registered temporarily to practice medicine in the country that we are going to. In this case was Japan, right? And also it's useful if we have connection, friends, or network, personal network, and this is something that I fostered over the years, many years of being a team doctor. We make friends all over the world. In case we need help, yeah, we can approach our local friends down there to help us, yeah, if we get stuck. Can I have the next slide? Next slide. Yeah, okay. So I'm going to spend the next 5 minutes talking about COVID-19 measures, because this was of great interest to the Singapore public. the media, many people, right, were very concerned. Yeah, I was asked, oh, are you sure as a CMO, is it safe or not to let our athletes go down there? What if anything happens? So many questions I was asked personally. I even had people who wish that I wouldn't go myself personally, in case you get COVID, what will happen? You're already, in your 50s, what if you get so sick, then you get into the ICU and die there, things like that. So people are concerned for me personally too. But I said, well, we do the best we can, and somebody needs to look after our team, because our team is going, right? They are going, right? They are going after having assessed the situation and the safety and all the protocols that have been put in place. Yeah, it is safe enough for us to go. Yeah, that was the decision, right? Yeah, we trusted that our host, and indeed our host far exceeded what we could ever imagine. Okay, so some measures that we took were to, of course, vaccinate ourselves, right? So every member of our team was vaccinated. Those who were based locally were locally vaccinated. Those who were based overseas were vaccinated overseas. And because they are not typically, some of them domiciled there, we had to speak to different people in the other countries to vaccinate our own team members. Okay, and it got done in the end, right? The other thing is what we call a travel essentials kit and antimicrobial treatment, which I will talk when I show another picture, right? Then there's something called the Tokyo Playbook. So if you look here, this is a playbook. There were 3 versions of it. So the last version was released in June, and it was a guide for us to reference as to what we needed to be before we departed, at the airport, as well as upon arrival and then departure, right? All in the interest of our safety and our health. We also appointed what is called a COVID liaison officer, which was one of our secretariat, and everything about COVID went through him, in as well as out. Okay, right. So the Tokyo office will transmit to him, and he gives information to us, and whatever we need, we also go through him, right? Yeah, including saliva collection every day for antigen testing. All right. We also had to submit what they call a 14-day activity plan. So in place of what you call quarantine, because we didn't need to be quarantined at the airport, we just went directly from the airport, do our PCR arrival test, and then we went straight into the Games Village in what we call a bubble, right? So we didn't have, that was our equivalent of quarantine, because we couldn't go anywhere except airport to Games Village to competition venue and training venue, and back to the village. We were not allowed to step outside otherwise. So it's like a prison, yeah, back and forth like this. But nevertheless, even within such a bubble, we had to submit our plan as to where we would be. Yeah, will we be like Games Village, table tennis venue, and back? Yeah, so they wanted to know our movement every day. So we had to lock this in before we departed from Singapore, right, or wherever we were coming from. We also had to download apps, much like in Singapore. You have something called, we use the Trace Together app. They also had what they call a Coco app and an Ocha app. So the Coco app was something, it's like a Trace Together app, and the Ocha app is a health app. Yeah, it's a health app where you have to log in every day, whether you are having cough, sore throat, fever, running nose, and your saliva tests are also documented there. Every day your results are documented there. So it's like a health profile, just like a health hub, that we have. Okay, just like a Singapore Health Hub. So this is like a hub, right? So they could track us. And for example, let's say if I were to get a sore throat and I log there that I have sore throat, it will get triggered, and the Singapore COVID liaison officer would give me a call. Hey, Dr. Teoh, are you okay or not? You got sore throat, is it? Okay, so that's kind of how it worked. And before we left, we had to do 2 pre-departure tests. And when we arrived, we did PCR again. And then when we departed, we did another PCR to come back, right? And then upon arrival in Singapore. So we had to make sure all this was in place, yeah, and set up. Can I have the next slide, please? So this is the Team Singapore Travel Essential Kit. Yeah, so we assembled this. Yeah, the Singapore Sports Institute helped to put this together for our team, both for the Olympic as well as the Paralympic team. So you can see we looked at many different kinds of masks, and we settled on a KN95 mask. We also provided surgical masks, but the KN95 mask, we asked our athletes and officials to wear this on at all times, except if they were training maybe in a facility, they could wear a surgical mask. But as soon as they came out, they put back and wear N95 mask again. So basically for myself, I was wearing N95 mask or surgical mask the whole time until and unless I was alone by myself in my room. I got so used to wearing masks the whole day long. Okay, yeah, right. There was also a face shield, so we encourage people to wear face shield where it was crowded and on the plane going to and out of Tokyo, right? Hand sanitizer, wipes. This is a spray. We use a particular antimicrobial spray. All our clothing, our attire, our shoes, our water bottles, our bags were all pre-treated before we departed for Tokyo. Okay, those antimicrobial coating. It's using nanotechnology, right? Then we dispensed all this to them: disinfectants, exercise mat, and things like that, and also a thermometer. Okay, next slide. Right, and then here in the Games Village itself, there was what we call a fever clinic. So if you had fever, you went straight to the fever clinic and not the polyclinic or your own. You could come and see the team doctor first, and if you needed any tests and further tests, you go straight to the fever clinic. You will not be mixing with the rest of the what we call the general polyclinic area. Okay. There were also quarantine facilities set up on site in the Games Village as well as elsewhere outside of the village. Okay. There was also hospital care if people did get sick, right? And there was something called a results advisory expert group, which was in the event of any athlete or athlete who got ill and needed to be withdrawn from. They would consider whether an athlete needed to be withdrawn, especially a close contact. If you are positive, of course, you'll be withdrawn from competition altogether. But if you're close contact, then there lies in, what do we do with this person who's a close contact? Okay. And the hygiene protocols in Tokyo were that a definition of close contact is exposure for 15 minutes within 1 meter without mask. Okay, that is defined as a close contact. So we emphasize wearing masks, hand hygiene, and social distancing, minimum of 1 meter, preferably 2 meters. Okay. We tried to room as much as possible people within the same team in the same apartment, right? And not to cross over, right? Dining halls and gyms, I will show you later what they look like. Transportation, all by their controlled transportation, no independent transportation. And this is what you look. This is our medical team set up in the main games village. So here is an apartment. You walk in, and this is the waiting area. This is a thermal scan to measure the temperature. Here are the disinfectants. This is the medical room which I set up. Yeah, so patients would come in here if they needed to see me, and they can go right out. Okay, crossing over this side, this is the physiotherapy room, and this is one of them like that. These were all covered with disposable covers, so we take them and throw them away after every patient, and then after that you also wipe down. Okay, right. So every day we would wipe down. After that, between patients we would wipe down, and then after that, at the end of every day, we would wipe down the whole place. Okay. And when we came back from Tokyo, we had SHN for 2 weeks in the hotel. Right. Can I have the next slide? All right. Now, what was special this time was usually as a team doctor, I'm never involved in press conference. Okay. Usually it's all these other people here from Team Singapore, as in Secretariat, Singapore National Olympic Committee, Singapore Sports Institute, right? And then our chef de mission this time was Dr. Ben Tan, right? And usually as a CMO, I'm never seen. I'm at the back end. But this time they say, no, Dr. Teoh, you need to be up here because they're going to ask the press. It's very likely to ask many questions about COVID, right? And so here I was. So I had to have press conference training for 2 hours, right? It was very stressful for me. Yeah, next slide. Yeah, and then it was in the newspaper. So we had to kind of assure the athletes, the officials, the family members, and indeed the Singapore public that we were going to take care of everyone, yeah, including ourselves, right? Next slide. Okay, so the Team Singapore Medical Services over there, we have, this is all of us, you already saw us all, right? We also have something called the Safeguarding Officer, which has to do with safe sport, right? Yeah, in case there were any untoward incidents that we needed to address, okay? I was on call 24 hours a day. Yeah, at any time people could call me for anything at all to do with their health, right? If they were concerned. We also had what we call a mental well-being and crisis support plan. because we weren't sure what it was going to be like, whether people needed to be isolated, we were going to be isolated. In the end, actually, we could move around. It's just that we were quite careful of keeping social distancing, but still we could see each other in the corridor, and also we didn't have to be locked up inside our room, and then socialize at all. Yeah. Next slide. Okay, and then the host provided a polyclinic, hospitals, even at the venues there were also medical posts. So we were well taken care of, all right, by the host. Can I have the next slide? Okay, so this is some other pictures of our own medical center. Yeah, so here you see there's a little corner for stretching. This is a fridge where we can put cold drinks and things like that. And this is a Hui Kun. This is the physiotherapist work desk. And there was a toilet here and then a wash area because we need to be able to wash our hands. Remember, hand hygiene, right? Other than the sanitizers. Okay, and this is inside the medical room, which I sat to see patients. And this is all the medicine, okay, and surgical supplies. Okay, so we arrive early. When we come, what happens is Hui Kun and I arrive first. So we recce. This whole place didn't look like that, it's like empty with some equipment, some tables and chairs, and now that we have to set up the whole center, just like a field clinic, right? We set up the whole place and then we go around the village and start recceing. So I'm going to show you some pictures, right? We also communicate with phones. We set up chat groups, right? We find out how we move around, where our cars are. So our team was assigned one specific car just for us, but generally we would travel with our teams on buses, right? And the car is actually, in case of emergency, we need to go from place to place, okay? So can I have the next slide? Right. Okay, so we went to recce, Hui Kun and I. We went to the polyclinic. So in the polyclinic, this is a registration area. You can see these are all barriers, right? So when patients would sit and athletes would sit, they all are individually partitioned, right? You sit here, you sit here. So it's all partitioned. You can see the outer G treadmill, also there's a partition. And then after that, inside here, this is the physiotherapy center. You can see the baths, all the ice baths, they are all also partitioned, right? Next slide. Yeah, and then you see more partitions. Now I'm taking you to the gym. You can see all the treadmills have partitions between them. All the bicycles have partitions between them. This area here is the dining hall. And this is not the operating theater washing area, it's the dining hall. You can see this is what we find in big hospital surgical theaters where surgeons scrub. So we could wash our hands here, wipe them. This is a hand sanitizer again. Put on your gloves and then you take the cutlery and go into the dining hall. Right, so the dining hall, all are partitioned like that. You can see every table has antiseptic wipes and it's partitioned all the way to the top. Even a man who is like 6'2", the partition can partition until that high, okay, when you are seated. And this one here is a gauge of how busy the dining hall is and indeed the plaza, because remember we had a Coco app, right? So they know where we are located at any one time. So you can actually see how busy the dining hall is, okay? Right, and anywhere else, right? Can I have next slide? Okay, and this is the dining hall itself. So what happens is, you see, people could still have a buffet, right? Because there were thousands and thousands of people we are feeding. So it's not possible to give small packs. You might have a 6'4" player, basketball player, and you cannot be giving him little packets of food, right? So we could help ourselves to the food. Food is all exposed, but you see, we are all wearing masks. And all of us wash our hands, hand hygiene, and put on gloves, right? So people would help themselves to the salad, the bread. You can see, if you don't wear your gloves at the beginning, right at the start, there's gloves there itself. There's sanitizers here. So if you open the fridge, close it back, there's hand sanitizer here. So there's sanitizers everywhere. So when I first came back to Singapore, I thought, where are all the sanitizers? That was the first thing that occurred to me. How come there's no sanitizers? I was looking everywhere for sanitizers because we were spot in Japan, not just in the village, even outside in the malls, in the train stations and all. Okay, can I have next slide? Right, and so these are some of the friends we made. So at the CEO briefing, I caught up with some old friends and I made some new friends. This gentleman here is the WHO rep in infectious disease, and he had only just 2 days before that did a webinar in collaboration with Prof. Dale Fisher in NUH, right? And he knows many of our ID physicians in Singapore, right? Can I have the next slide? Okay, and these are this place here. This is at the rowing area. And so I just wanted to show you what it looks like in the medical facility there. So this is the ambulance. This is the stretcher, right? And this is the field hospital, and this is the Japanese medical team who was looking after the rowing site, okay, as a venue medical cover area. Yeah. Next slide. Okay, and then when we work at the games, what happens is we share and learn, and every day if there's anything pertinent, we share with one another so we can update one another and then we learn together, right? The lessons we learn every day, right? And we document everything that we see that is pertinent so that when the athletes come back to Singapore or they are going back to their own country, they can be followed up because there may be new problems that crop up, okay? And in the event there's any emergency or evacuation or hospitalization, we also need to update one another and update as needed, maybe their next of kin back at home in Singapore, okay? Our day can be very long. It may start at 5 o'clock, 6 o'clock. It maybe even start, we started at 3 a.m. Okay, this is taken at 4 o'clock. This was at the marathon swimming area. Okay, because marathon swimming started at 6:30 and our athlete was really out there by 3 and Hui Kun and I were out there by 4. Okay, so the day was very long, right? Sometimes it's not just medical things. This is actually laundry. So when I could had time and everybody else was busy, I took our towels for laundry. Okay, from our medical team. Next slide. Right, these are some more pictures. Yeah, this is our rower, Joan. She's a staff nurse in Tan Tock Seng. This is Ken Yu, our badminton player. Yeah, and this is some of the anti-doping people over there in Tokyo from different countries. This is our own Singaporean staff from Anti-Doping Singapore. These are some of the Japanese doctors who are orthopedic surgeons and rehab physicians who help us. They spoke good English. Very proficient in their English, so I ask them for some help sometimes. Okay, and this is at the polyclinic. Next slide. Right, and these are just some more pictures of us around in different parts of the competition. Next slide. Okay, so when we come back from Tokyo, we kind of do some reflection, right, of what we learned, how we can do things better, and we get feedback, and then we compile a report. And then we give it to the Secretariat and then the Singapore Sports Institute as well as the SNOC, so that because we have games all year round, and so we take these lessons, especially the lessons we learned from about COVID. Okay, so because when the next SEA Games, the next Commonwealth Games, there's still COVID all around the world, and it might be something that we just have to live with. But one of the things I learned was because of the mask and hand hygiene, actually for the first time in the whole of my games experience, I didn't see a single runny nose, cough, sore throat, or fever, or diarrhea. So that was some takeaway about hand hygiene and mask. Okay, that's all from me. Last slide. Yeah, and none of this can happen without the team. All right, so this is our team of our physiotherapists, our sports scientists, and some of our secretariat. We are missing 1 or 2 people, but we were celebrating also. We also must have some fun and remember our birthdays. So this is our physiotherapist, Pauline Leong's birthday, and her colleagues tune in from Sengkang Hospital on the laptop. Okay, that is the beauty of technology, right? And the last slide is just our mascots. I just wanted to show you. Yeah, one is a Tokyo mascot from Olympics. The other one is the mascot for Paralympic Games. So thank you so much for letting me share, and I hand over the time to our MC.
Thank you, Dr. Teoh, for the very interesting and insightful talk and sharing your unique experience with us. I'd now like to introduce the second speaker for the afternoon. So having worked at the Singapore Sports Institute from 2010 to 2011, Ms. Nurhafizah Abu Sujad joined the Football Association of Singapore in 2012 and is currently leading the Sports Medicine Department as the head physiotherapist in one of the Singapore Premier League clubs, Lion City Sailors Football Club. She has been a mainstay in the national football scene, being highly involved in the national men's A-team injury management, especially during the FIFA international window period. She is also nurturing new physiotherapists who are keen to cover sports and football in their area of expertise. She's certified in aquatic therapy and enjoys doing hydrotherapy sessions with her injured players as a form of recovery. This afternoon, she'll be speaking about handling the national football team during COVID-19, in particular during their international assignment for the World Cup qualifiers for 2022 earlier this year, and about living with COVID-19 in team sports and how the football fraternity in Singapore has had to adapt during this pandemic. Without further ado, let us welcome Ms. Nurhafizah to begin her talk.
Okay. All right, apologies. Yeah. Good afternoon, everyone. Yeah, my name is Fiza. I'm the head physiotherapist for the Singapore Men's National A team, as well as the Lion City Sailors Football Club. First and foremost, thank you, Dr. Shona and SMES for inviting me to share my learning experience, as well as my sharing to share my experience, working with football during this COVID-19 period. Okay. So basically, as we know, the COVID-19, the pandemic started actually in late 2019. And for the Singapore national men's team, our last competition was held in Bahrain in November 19, whereby we played against Yemen for the World Cup Qualifiers 2022 campaign. So that was our last in 2019. And in 2021, we were supposed to prepare for a very busy year. The Singapore men's national A team was supposed to be involved in the continuation of the campaign of the World Cup qualifiers. We were doing quite well. We were third. Yeah, so we were actually hoping to continue our good performance. But unfortunately, come 7th April, the Singapore government implemented the circuit breaker measures with us going to lockdown on 7th April 2021. And because of that, in 2020, most of our major tournaments that were supposed to have, the World Cup qualifiers, the AFF Suzuki Cup that was supposed to be held in November and December, were all postponed. So how it affected the football scene with the circuit breaker phase. So what happened, the Singapore Premier League, the professional football league that is held in Singapore, were actually suspended as well. So all the team players actually went into online training via Teams or Zoom sessions. So the team coaches actually monitor the training sessions, group teams, training sessions via online. And they also had remote monitoring, whereby the fitness coaches or even the head coaches actually get the players to do runs, they monitor the heart rate and things like that via remote online monitoring. So for me personally, as a physio, it sort of affected how I actually treat or deal with the players. So just before the circuit breaker, so I had 2 key national team players who were down. They had an ACL recon just before the circuit breaker started. So basically for me as a physio, normally during the phase 1 and phase 2 of the ACL rehabilitation, I see them regularly, intensively, daily in the clinic. But unfortunately, because of this situation, so I wasn't able to see them face to face. So instead, it had to be done online. Yeah, so it sort of affected, it changed how I deal with this high elite athletes. So for at least 2 weeks, we actually communicated via online. So, I was hoping that I could do more. Usually when we actually see them in the clinic, it's basically a lot of manual therapy. We make sure that they've got good knee extension, they're able to walk properly. But for that 2 weeks, it was really frustrating at times. But we had to stay positive. But thankfully, we got the approval from the MCYS as well as relevant personnel who actually approved this elite players to actually see me 3 times per week in the physio clinic. Yeah, and of course, with the circuit breaker, all sports and recreational facilities were closed. So therefore, there wasn't any team training at all. Thankfully, we came to the next stage of lockdown, whereby Singapore Premier League, the professional league of football, were able to train in 5s. But of course, there were a lot of controlled measures, a lot of SOPs were placed, during this period. So we had to do a lot of, SOPs, daily monitoring of temperature, how we handle equipments like the balls and even the beeps. We have to sanitize them. Yeah, and then the drinks. Usually players, they tend to sort of mix, in terms of how the bottles. But because of this SOPs, everybody is individualized. It's all labeled. Yeah, and there was no intermingling at all. So we really had to follow the protocol properly, embrace this new situation positively, follow the SOPs really very closely. There were actually 1 or 2 clubs that were suspended because they did not follow the SOPs. Yeah, and also the articles, if you could see, they did mention that there were, a few professional players were having mixed feelings, whether to actually really come out and train, during that pandemic, because they were unsure what is this COVID-19 all about. But I guess with education, with a lot of SOPs in place, that gave them the confidence to continue to train. And we're just waiting, for the next phase whereby we're allowed to train full. So, from experience as well as, articles from other countries. So for example, in this article in TNP in May 27, 2020, so there was this club basically in Germany whereby they started to resume the league after circuit breaker. So they were in a few months of lockdown, and then they started to commence the league. So there were a lot of injuries, during the first day of the opening of the league, and the rate of injuries were high. Average rate of affliction from 0.27 per game to an alarming 0.88. And this is attributed to the condensed schedule that they have, because they have to fulfill, they have to finish that certain number of games within that period of time, because they have to ensure that the games go by and complete on time. So another experience or article that we have sort of look at to reflect is the NFL lockout, which happened in 2011, whereby the NFL was actually on a period of long absence, from activities from March 2011 to July. That was like good 4 months. So in this article, May et al. Cited that physiological changes in tissues such as tendon, which during periods of lower activity will actually cause deprivation of a stimulation in its different degrees of tension. And because of that, it loses its mechanical properties, especially the capabilities to absorb loads. And indeed, when they resume the league, the number of Achilles ruptures increased from 6 to 10 per season to 10 in the pre-season period alone. So with that, we anticipated, okay, so in the Singapore Premier League context, so if you were to begin the Singapore Premier League again, with probably 3 or 4 months of inactivity, these are the probability that could lead to an increase in injuries. So the effects of possible asymmetrical detraining leading to modification of ligament, muscle, and tendon properties. And how do we actually, with the inactivity periods, how can we actually gradually increase the training load? And with the increase in the density of matches, just to finish the football competitions on time, how will that have an effect on the injuries? So they have decided that the Singapore Premier League will commence in September 2020. And because of that, the FAS, the Football, Sports Science and Medical Department, we actually gather the physiotherapists as well as the sports trainers, and we actually conduct clinical education on injury prevention, how to strategize training loads as well as proper recovery, and basically the goal is to minimize injuries. So sadly, as much as we want to minimize injuries, as expected, we saw a rise in the number of injuries during the first 2 months. And we had 4 ACL cases within the period of 4 months, from September to November 2020. And this was what we were anticipating as well. So here we've got Huzaifa, who's one of our key national team player who actually suffered an ACL injury in October. And we had here our striker. If you can see the guy in blue here. So this is his first game. It's the first week of the SPL. And sadly, after a contact injury, he actually sustained an ACL tear. Okay, so moving on. So what happened next in 2021, which is this year, the Singapore men's football team was the first team sports that was given the green light to travel overseas for a major tournament. So we actually continue our campaign, which is the World Cup Qualifiers 2022 campaign. Yeah, so having been absent or inactive for the period of 2020, so this is quite refreshing for the national team. So we actually had to do lots of planning, the backroom staff, from the sports scientists, the sports physiotherapists, as well as liaising with our sports consultant, Dr. Cormac. So we actually come up with a lot of SOPs together with the FIFA as well as the AFC medical staff. So one of the things is that the players and officials were made mandatory to get the vaccination. And then because we were traveling in May, late May, so the players were actually sort of rushed to do the vaccination in March, February and March. Yeah, and because of this pandemic, you know, somehow the format of the FIFA international tournaments, the AFC international tournaments have changed. You know, usually we would have home and away format, but because of this pandemic, I think they want it to be more controlled. It has been changed to whereby all the 3 teams in the group actually come to a centralized venue, whereby it's much more controlled. SOPs were managed proper. So we were supposed to travel, we actually traveled to Saudi, where we actually would play 3 games within the periods of 2 weeks. So SOPs were followed very closely. We actually went to Dubai first for our training camp. Basically in Dubai is for us to acclimatize to the weather. In Dubai, we were very lucky because we didn't have to do a quarantine. So basically we just go in and we stick in the travel, or rather a training bubble. So after a week in Dubai, whereby we gather all our overseas players, we actually went to Riyadh, Saudi, for the tournament itself. And this was our very first major tournament since 2019. It's a new experience for everyone because, you know, this is the first time that they are traveling in this COVID-19 period. There were a lot of anxiety, you know, what's going to happen, you know, if somebody has this, and then they have to go through all the different testings, you know, the PCR every two days and things like that. So for us in Saudi, what happened is that we actually stayed in the hotel with training bubble, whereby we are only allowed to go out to train as well as to play. And the hotel was limited to just our team, our contingent, together with an AFC doctor as well as the staff. And all of us are supposed to go through testings to ensure that everybody is safe from COVID. There were no other patrons allowed to be in the hotel. And one of the safety measures, of course, is we have to be masked at all times, sanitized, and we travel in 2 buses. So for the team of 40, we traveled in 2 buses, making sure that there are actually distance kept between us. So like I've mentioned, before every major game, we actually do our PCR, and we do temperature screening every day, daily, before breakfast, just to ensure everybody is safe and healthy. Yeah. So some of the learning points, you know, from this campaign is that sadly, because of the lack of competitive games for the national team, it sort of affected the performance of our players because the 2020, we didn't get that opportunity to train together. We didn't have the Singapore Premier League in, you know, really in action. So it's only in 2021 we get together in Dubai, and that's where we actually come up together and play our first competitive game. And issues with traveling, especially quarantine for our overseas-based players, I think it created a little bit of mental effect, or a negative mental effect on them, in the sense that, you know, like we've got one of our overseas-based player, Irfan Fandi, who are from Thailand, and he has to come back to Singapore before we could travel to Dubai. And there was sudden change from, you know, 14 days of quarantine, and then suddenly there was an increase to an extra 7. So he had to serve an extra 7 days. And it was very negative for him. It was quite traumatizing for him, because having to stay that extra 7 days. So we had to do a lot of, you know, counseling, a lot of psychological, a lot of talking with him just to calm him down. And somehow it affected, you know, a bit of that preparation towards the World Cup qualifiers. And of course, you know, the players and the officials, we have to follow very strictly with the PCR testing and the protocol. So it's like a new norm for us. So like I've mentioned about, you know, the effects of quarantine, you know, and how to reduce it. So we try our very best, you know, to be able to communicate with the relevant players, because we do have about 3 or 4 players from different countries like Malaysia, Thailand, as well as Norway. So, you know, when they come here, they're quarantined. So how can we actually decrease that psychological impact on them? Yeah, so it's a lot of communication with them, you know, making them, you know, doing certain things, a program, a fitness program, just to make sure that they maintain, what do you call that, their fitness level, as well as to keep them occupied so that they remain positive. Yeah, and, you know, for us, after the World Cup qualifiers, the team came back, and we were very lucky that we actually were able to come out, even though we have to serve the SHN, but we were actually allowed to train. So we're in a training bubble, so we actually can come out daily to train. But for some of the players, returning back from Saudi and then they have to go back to Malaysia or Thailand, they have to serve the 14 days of quarantine. So it's a lot, with the traveling, with the competition, and then having to serve the quarantine, that has some impact on the players. So, and now in 2021, so living with COVID is something that is, it's a new norm. So for me, as I take back my role as a physio in the club, we had 1 or 2 cases whereby, doing the weekly PCR, there were a few cases of positive players who were positive with COVID, and then there were postponement of games in the SPL. So, with all this postponements and all that, there were delay in the timetable or the schedule of the SPL. And for me personally, what happened was that we had some key officials and players who were positive with COVID. There were a lot of implications on how we manage all this. I think as medical staff, I think because my club, we don't have any doctors, so it's me. So it's how I need to handle this, this sudden anxiety and tension. So just to share with you, just before our big game whereby we were supposed to play our very last game, and that would determine whether we're going to be the champions or not. So we had one case whereby a player was positive. And that created a lot of anxiety and tension amongst the players as well as the officials, because we were in close contact and things like that. But thankfully, because the SOPs were in place, and then we follow closely what the ministry has sort of gave us the guidance. So I had to stay calm. I had to speak to the officials that we have to be calm to manage this, because we have a game the next day, and how can we actually keep them calm and then prepare for the game tomorrow. Yeah, so it's a lot of learning process here. And then the coaches themselves, how they handle that sudden change, the anxiety and tension. Okay, if their key player is out, okay, how are they gonna, there's a lot of tactical changes that they have to do as well. Yeah, so, and then we shifted, from the weekly PCR that we do to daily ART. And then it's good that the players, even though they were anxious, they were calm, and then they followed the SOPs properly. So now, as I'm talking to you guys, I'm actually serving my SHN in Hilton. So we just came back from Dubai. So I've got another 3 more days before I'm out from this hotel. So we are preparing for another important tournament, which is going to be held in Singapore this year, December. So AFF Suzuki Cup 2020. And okay, so preparations have also been hit by COVID-19 as well. So we've got our Captain Haris Harun, who was positive 5 days before we were to travel. And just before we were to travel to Dubai, Hafiz Noor, who's another key player, was issued a HRW, which is health risk warning. So he had travel restrictions and couldn't travel with us. Yep. So this came out in the newspaper as well as Channel News Asia. So, so throughout this trip, we had to overcome the challenges. We had to stay positive, and because of that, we implemented more rigid and thorough protocols. We actually, like really reinforced to the players, they need to ensure their hygiene is being maintained at all times. They need to make sure that their mask is on, they sanitize at all times. Yep. To ensure that their immune system is kept at a high level. We keep them hydrated, we give them zinc supplements, and we make sure that they are well rested throughout this stressful and long journey in the preparation for the AFF. So for players who are COVID positive, which we have so far 3 cases, they are actually kept in isolation, and then we actually support them. We give them like swing bikes or conditioning exercise with resistant bands. So we monitor them. The moment they are good, the symptoms are settled, that's when they actually start the program. So it's really a lot of close monitoring, a lot of remote monitoring with these players. And once they return back to us, okay, we do a proper surveillance and monitoring. We do our daily wellness and RPE to monitor their recovery and load at training. So we've got this app whereby the players have to like, every morning they have to tell us, okay, how they are feeling, whether they slept well, whether they feel any, pain and or even like tiredness, and then they actually report it back to the app. And at training, we actually monitor their heart rate and GPS and how they respond to trainings and loads. And this is very important because especially for one or two who just came back from COVID, because we're not sure how the response is, because with viral infection, they seem to be fine, but the moment you stress them a little bit, they have difficulty coping with the level of training loads that were given to them. So these are the things that we use to monitor the players. So what I have learned personally, not all COVID positive cases are similar. I've still got one who's with me currently. He's still trying to adapt, to the training loads, even though his symptoms were not bad, but the moment we stress him a little bit more, he has, difficulty coping with it. So his immune system is not 100% yet, but he's somehow, normalizing already. And because of this, I spoke to our chairman, FAS Medical Committee Chairman, Dr. Dinesh Nar, as well as our senior sports consultant, Dr. Cormac, and Dr. Teoh herself, who's she's in charge of the Sports Medicine Center of KTPH. How can we actually help this COVID-19 positive athletes, elite athletes, to come back and return to train and play safely? So for Captain Haris Harun, what we did was, because we know that with viral infections such as COVID, there's always this chance, of myocarditis, inflammation of the heart. So we actually came up with this simple test. It's actually a cardiopulmonary screening test. So we actually put Haris on the 2D echo stress test, to rule out any, any signs of infection or any infection of the heart. So this is another good article that I actually sort of have guidance from, graduated return to play guidance following COVID-19 infection. I think this was released by BJSM in 2020 last year. So at the end of this, in 2020, 2021, so the take-home message for me personally is, it's every day is learning and it's a discovery for me. And it's how to manage anxiety and uncertainties, especially when you're in team sports and you're the medical personnel. You need to remain calm at all times, because this COVID-19, you don't know when it will hit you, and how is it going to hit you and how you're going to recover from it. So I think what I told my fellow team members is that we always have to stay resilient and we have to stay positive. So with that, I thank you.
Thank you to both speakers for your very insightful and interesting talks this afternoon and sharing your expertise and experience. It has given us all an insight into how the athletes and medical teams have had to cope and adapt with COVID-19, and gives us many practical tips to bring back to our own practices. I especially like to thank both speakers for taking time out of your busy schedules to be here today, with both Dr. Teoh and Fiza having upcoming assignments to take care of our national athletes at the Asian Youth Para Games and Suzuki Cup respectively, amongst many other commitments.